So, so I think काफी learning एक केस में हो गया है.
Yes, sir.
एक तो they also agreed with me कि you can't follow diagnosis of parsimony. Diagnostic parsimony is basically Occam's razor. Huh? They also mentioned the same thing. You can have different things at different places. Barabar? Then seropositive with low CD4 with CMV retinitis with tuberculous hepatitis with CNS, possibly CNS tuberculomas with post treatment hypercalcemia which responded to steroid. बराबर ये सब चीज एक केस में हो गया. This is the beauty of cases. They take you to all different areas and explain everything very well.
Yes, sir.
Any questions from your side? We also even considered toxo. We considered
Yes.
CMV encephalitis. We considered hand.
PML.
है ना?
Yes, sir.
ये सब भी rule out हो गया ना clinically.
Yes, sir.
ठीक है?
Yes, sir.
Then rifabutin induced fever भी हुआ.
Fever भी हुआ. Yes, sir.
Why they gave rifabutin, I don't know. What can be the reason to give rifabutin in this patient
Sir,
instead of rifampicin?
rifampicin causing hepatitis, more hepatitis. So they can give rifabutin as an alternative.
That's mostly not the reason. Rifabutin also causes hepatitis, joint pains, cytopenias because करता है. The reason is that if you are going to start somebody on ART, then there should be no interaction with the rifampicin.
Okay.
So even though you may start the ART 2 to 3 weeks after you start the AKT, it stays in the system. So you can't change immediately. So the most common reason for using rifabutin instead of rifampicin in seropositive patients is actually that you want to start the ART which is going to have protease inhibitors.
Yes, protease inhibitors.
So efavirenz का इतना interaction नहीं है. Efavirenz के साथ दे सकते हैं rifampicin, but protease inhibitors के साथ rifampicin नहीं दे सकते.
Okay.
तो rifabutin देते हैं. So their plan must have been to give either atazanavir, lopinavir, indinavir या तो ऐसा कुछ.
Yes, sir. They have
some
given
protease
atazanavir.
inhibitor. Yes.
Yes, sir.
Yes. So that's why you can't use the rifampicin. So there's an interaction between atazanavir and rifampicin. But I would not choose atazanavir in this patient.
Yes.
Tell me why. I would choose some other protease inhibitor. See, what is another main interaction of atazanavir is pantoprazole.
Okay.
Proton pump inhibitors cannot be given with atazanavir because it reduces the absorption of atazanavir by 70%.
Okay.
Yes,
समझा?
Yes, sir.
So now this patient is very likely to need pantoprazole
Because of the duodenal ulcer.
because of the esophageal duodenal ulcers and also because patient is going to be on so many medicines.
Yes.
AKT, steroids, ART, plus he has a hypercalcemia. उसका भी होता है ना constipation कुछ तो.
Constipation.
है ना?
Yes.
हाँ, तो ये सब चीज से उसको GI disturbance बहुत होएगा. So since I want to use proton pump inhibitors, I don't want to use atazanavir. I would choose lopinavir or something. Or rifavirin actually. उनका protocol अलग है. Sometimes they had a protocol of not giving efavirin. They would go for protease inhibitors upfront.
Yes, sir.
Depends on the time period that you are looking at. Guidelines उनके change होते रहते हैं ना.
Yes, sir.
बराबर. Now there is one more connection I can think of. Some protease inhibitors cause renal stones. Mostly it is indinavir.
Indian.
You would want to avoid that also because patient is already hypercalcemic.
Hypertensive. Yes.
बराबर.
Can cause.
So many things are there. In each patient you have to think this hard. That's when you reach the level of artistry.
Yes, sir.
फाइनल लेवल काम कोई भी कर सकता है.
हम्म.
मजा नहीं है उसमें.
हाँ.
ये करने में मजा है.
Yes, sir.
बराबर ना. हाँ
बराबर.
ठीक है. चलो विल स्टॉप.
Thank you, sir.
हाँ?
Thank you so much.
तो acute HIV लगा तो करते नेक्स्ट टाइम.
Okay, sir.
हाँ.
इसका मुझे लिंक भेज दो. बीच
Yes,
बीच में रिकॉर्डिंग स्टॉप हुआ था ना शायद.
हाँ, sir.
कोई बात नहीं. जो भी रिमेनिंग पार्ट है वो
वो
भेज.
इनिशियल जो केस डिस्कस किया ना, केस मैंने रीड आउट किया था,
History वाला part
हिस्ट्री
थोड़ा
पूरा
miss हो गया था, sir.
तो एक तुम फ्रेश वीडियो बना दो, उसमें इन शॉर्ट हिस्ट्री डाल दो.
Okay,
एंड
sir.
बाकी रिमेनिंग पार्ट अपना ये कर. हाँ
रिमेनिंग
Okay, sir.
हाँ
Yes.
ठीक है सर.
ओके चलो बाय.
Thank you, sir. Bye, sir.